All right, thank you for staying with the Monday Report. The town hall session begins right now. Let me introduce my guest, beginning from my farthest right. Benjamin Mushiri is here. He's a senior manager at the macroeconomic statistics at the KNBS. That is the Kenya National Bureau of Statistics. Thank you so much for making time. Vivian Nyarunda is next. She is a senior manager production statistics at KNBS as well. Thank you so much for making time. And last but not least, MacDonald Obudo is the Director General, Kenya National Bureau of Statistics. We're going to talk about the Kenya Demographic and Health Survey. If you're wondering how this is done, watch this.
Developing countries have issues with population growth, ailing economy, health hurdles, among others.
We are not very stable when it comes to health-related matters. We are not able also to, we are also not very okay when it comes to controlling our fertility levels.
To plan for, develop policies and implement them for a healthy population, a survey needs to be done to yield actionable recommendations for various policymakers. KNBS is mandated by the law to undertake surveys, currently doing DHS, aimed at gathering data that will draw recommendations for the health sector in issues surrounding fertility levels, contraceptive prevalence, child and maternal health, domestic violence, non-communicable diseases, and other health issues.
DHS survey is a specialist demographic survey that is conducted to provide up-to-date socio-demographic and health indicators that are used for planning and measuring achievements in the health sector.
This process begins with identifying key indicators, setting up and preparing teams, deploying them to the field for survey, whose resulting data is analyzed, conclusions drawn, and recommendations made to the relevant policymakers.
We conducted the training in January. After the training in January, we embarked on now field work from 17th of February. Up to date now, we have been doing field work data collection and it's expected to end by mid-July.
We follow the right procedures. I also make sure that they finish their interviews on time and they complete all the interviews that have been assigned to us. And I also conduct spot check re-interviews. I do this so that we maintain the quality of data.
Our recommendations are actually based on the results that we are getting against the standard norms of what you would expect of an indicator. If it is higher than normal, you would alert the policymakers that here there is an issue which we need to deal with. From there then, we now leave it to the policymakers to deal with their bit.
Results of the preceding surveys translated to policies have seen infant mortality rate decrease, maternal health and uptake of contraceptives improve in the country to prevent population explosion in the future with scarcity of resources.
We have had the total fertility rate well controlled, because that it means then even the level of family planning, the way people are taking it, is making a lot of sense, and of course the policies that are designed around the figures that we've been getting.
Moving forward, KNBS looks forward to carrying out surveys that not only bear workable data but also help improve the well-being of each individual Kenyan.
We would want to see what is the situation of stunting, what is the situation of underweight. When you take salt, what amount of iodine do you have in that salt, so that you can trace it to even the manufacturers, because you know you'd want to have a healthy diet, you want to have everything put in the right proportion, and so we have also, it has been noted that the amount of iodine in food at times, in salt, at times it can be very high or low.